the point being here is that when we have patients who are coming in, we must give people feedback on how they're progressing with care, especially once they're feeling better. And ask yourself this question: have you ever had a patient come to you who's been to another chiropractor? And I'm going to guess you have. And if you've been in the habit of asking them why they're changing, you may have heard them say things like, well, I just don't know how I was doing over there. Or you might have heard them say, well, I just felt like they wanted me to keep coming back. There was this kind of negative sentiment about the previous experience. And the reason they get that feeling, the patient does, is because of the previous doctor's complete failure to properly give the patient feedback. So when you ask why it's important, is because people in general, and I don't say patients are people respond better when they're given feedback to something. So for example, let's say someone was on a weight loss program. That person, if you're measuring their weight and they're measuring their body fat analysis and doing all these things and reporting that back to them, they will perform better than if someone who is not getting any feedback reported to them. There's this thing called the Hawthorne effect. The Hawthorne effect basically says when you measure something and you report that feedback to the person being measured, their performance improves. So when you go back to your treatment plans, if you want your patients performing your treatment plans, following through better, you must give them feedback. That comes from the world of behavioral psychology. People need feedback in order to perform things better.